Good day, everyone. I am Joseph Abang, and I'm actually here to discuss with you the answers of our long test one, and that is actually the examination that you've had last Saturday. So I am actually in charge of two specific topics. The first one is care of adult clients with gastrointestinal alterations or disorders, and I've actually prepared 12 questions for this. So let's begin with question number one. The nurse is planning the care of a client diagnosed with acute gastroenteritis. Which nursing problem is priority? Of course, when we talk about gastroenteritis, it is very important that we have to remember as nurses, our nursing process. It's basically a scientific and, of course, our tool for clinical reasoning, especially when we are approaching our client, so that the care that we're going to be implementing is highly individualized. And of course, the patient here or the nurse here is basically responsible for identifying nursing diagnosis. So we are going to prioritize our nursing diagnosis. A, altered nutrition. B, self-care deficit. Letter C, impaired body image. Or letter D, fluid and electrolyte imbalance. Of course, we know that if there are two specific options that might actually be correct, or that might actually be the same thought, then we'll eliminate that one immediately. Letter C, impaired body image, is actually something that is in relation to self-care deficit. Therefore, we'll eliminate these two things. We know that self-care deficit is basically a psychosocial problem, and impaired body image is also a psychosocial problem. Therefore, they have the same meaning. Okay, so we'll eliminate these two immediately. And we know that if a patient has gastroenteritis, it is expected that this patient is going to have problems with diarrhea because there is gastroenteritis, right? So therefore, our priority this time is basically fluid and electrolyte imbalance, not altered nutrition, because of course the patient can still live for several weeks on minimal intake, but the patient might die because of fluid and electrolyte imbalance, because this could possibly cause cardiac arrhythmias or cardiac dysrhythmias. Therefore, that is our priority. Answer for number one is letter D. Number two, the nurse is preparing to administer a morning medications to clients on a medical unit. Which medication should the nurse administer first? Administer first. Keyword there, administer first. A, methylprednisolone or ursolimedrol, a steroid to a client with Crohn's disease. Letter B, donepezil or Aricept, an acetylcholinesterase inhibitor to a client with dementia. Letter C, sucralfate or carfate, a mucosal barrier agent to a client diagnosed with ulcer disease. Or letter D, enoxaparin, Lavenox, an anticoagulant to a client on bed rest after abdominal surgery. Of course, these medications might be very significant, right? So in this case, since our topic is basically on patient who has problems with gastrointestinal, therefore we will not answer something that is not related to gastrointestinal. We'll eliminate letter B because that is basically cognitive in nature. And we'll also eliminate letter D because that is based on circulation, because that's anticoagulant. Of course, we know that Aricept can be administered within 30 minutes time frame. So this medication is not the first medication that we need to administer. And then also, letter D is the same thing. We have a time frame of 30 minutes that will actually be given. So therefore, that's not our priority. As what I mentioned, if that is not related to what is being the topic, then eliminate this, because letter B, cognitive function. Letter D, circulatory, or that talks about your blood component. So we're left with letter A, Crohn's disease. Here, the patient is actually having problems with diarrhea also. And of course, letter C is also related to gastrointestinal. But in this case, the medication that we need to give first is basically what? Can you guess? The best answer for number two is letter C. So since it's actually a mucosal barrier agent, so the patient here has ulcer disease, it's very important that this medication is going to be given ahead of time, because we have to make sure that the patient has actually not taken any meal yet, because this medication coat the gastric mucosa. So since it's actually going to be a coating medication, it will be given first and prior to other medications. So letter A is also eliminated because there is a time frame for this one to be given within 30 minutes. So letter A, B, and D is of the same classification, it might actually be given on a 30 minutes period. So, of course, as a test taker, we should actually know the medication that has a priority implementation, such as medications that has life-threatening impact to a patient that will actually going to help the patient. And also we have insulin. So we have to remember these three medications. Probably this medication aids in uh, lifestyle life-threatening condition, and of course we're going to be giving insulin and also your mucolytics. So this has to be given ahead of time. So these three things, your medications that is going to address life-threatening condition, and also your insulin and mucolytics, and that is going to be significant. So that is letter C for number 2. Number 3, the nurse has received the morning shift report on a surgical unit in a community hospital. Which client should the nurse assess first? So we're going to be using assessment here. Letter A, the client who is 6 hours post-operative small bowel resection, who has a hypoactive bowel sounds in all four quadrants. Letter B, the client is scheduled for an abdominal peritoneal resection in this morning and is crying and upset. Letter C, the client who is 1 day post-operative for abdominal surgery and has rigid hard abdomen. Letter D, the client who is 2 days post-operative for an emergency pedectomy and is complaining of abdominal pain, rating it as an 8 on a pain scale of 1 to 10. Of course, the question here is assess first. So, ang letter A is actually expected. So therefore, this client is not our priority. Probably this client is actually the last that we need to assess because it's only 6 hours. 6 hours post-op, you're expecting that the bowel sounds are actually decreased. That's why it's very important for you to assess if the patient has resumption of a flatus. So if that's gonna be the case, then that is an indicator that the bowel has already returned. The peristaltic movement has already returned. And then, of course, since we talk about medical surgical cases here, therefore, psychosocial aspect is not our priority. So letter B is also not a priority because physiological problems is our priority over psychosocial. So since the patient here is crying, therefore, that's not our priority because that's a psychosocial aspect. Then, of course, letter D is our second priority because letter D, the patient here is actually 2 days already and complaining of 8 should furtherly be assessed, but the pain there is actually not life threatening. So, therefore, that is considered to be not a priority. So, the best answer for number 3 is letter C. The client is 1 day post operative for abdominal surgery and has a rigid hard abdomen. So because we know that a rigid hard abdomen is an indicator that there is peritonitis, which is considered to be a life-threatening emergency, that is why it's very important for this patient to be properly assessed immediately. So our priority here is letter C. Second is our letter D. Third is letter B. And then of course last is letter A. But of course the answer here is letter C. Number 4. The charge nurse is reviewing the morning laboratory results, which data should the charge nurse report to the healthcare provider via telephone. A. The client who is 4 hours post-operative for gastric flap banding with white blood cell count of 15,000 cubic millimeter. Letter B. The client who is 1 day post-operative total colectomy with creation of an ileal conduit who has a hemoglobin and hematocrit of 12 and 36. Letter C. The client who is 4 days post-operative for gastric bypass surgery whose fasting blood sugar is 180 milligrams per deciliter. Letter D, the client is 8 hours post-operative for exploratory laparotomy who has a serum potassium level of 4.5 milliequivalent per liter. Of course, time is an element here. So letter A is 4 hours, letter B is 1 day, that's 24 hours, letter C is 4 days, that's actually 96 hours, and then letter D is 8 hours. So therefore, we have to focus on time as an element. So let's eliminate letter C because the glucose level here is actually elevated. But of course, we know that many client who is actually uh, overweight since there is gastric bypass. So there's a need for us to uh, cut a bit of there's a not to bypass the route of the food. It's because of probably overweight. So since the patient here is expected to be overweight, so there is an expectation that there is going to be an elevated uh, uh, elevated blood glucose level. And then we'll also have to eliminate letter B, because we know that if the hemoglobin is actually multiplied by 3 and that is equal, so that is actually exactly the result or the product of the multiplication of 3. So 12 times 3 is 36. That's actually within the parameter. So it's between A and D. So the best answer here is potassium level is actually normal. For letter D, then that's actually not a problem. So the answer for number 4 is letter A, because of course the client here is actually having an elective procedure, which is actually the gastric lap banding. And prior to surgery, if there is actually going to be uh, elevated WBC, so this might actually indicate that there is actually an ongoing infection. That's why it requires uh, further evaluation by the physician. So we know that the normal value of our WBC is 5 to 10,000. So that is already an indicator that there is infection. So answer for number 4, letter A. 5. The nurse is preparing for clients for surgery. Which client has the greatest potential for experiencing complications? A. The client scheduled for removal of an abdominal mass who is overweight. Letter B, the client scheduled for a gastrectomy who has arterial hypertension. Letter C, the client scheduled for an open cholecystectomy who smokes 2 packs of cigarettes per day. Or letter D, the client scheduled for an emergency appendectomy who smokes marijuana on a daily basis. Of course, here we talk about the client here is for surgery, right? So we know that if the patient has actually been uh, a need for surgery, our priority is related to respiratory function. So we'll eliminate letter A and B, because overweight also has an hypertension. We know that it has of the same thought. So here we'll not talk about overweight and hypertension, because our priority this time is basically on respiratory function. So we know that the client who is actually overweight probably has higher risk for possible problems, but that is not directly related to respiratory function. And then, of course, if the client has arterial hypertension, so the client in here will need to be properly monitored, and there has to be an administration medication to decrease the blood pressure. But this is actually going to have not that high risk for post-operative complication. And then, of course, for number 5, letter D, if the patient here is actually using marijuana, so it will not actually have an increased risk for uh, pulmonary complications, because this marijuana might actually be utilized for possible pain management. So in this case, the best answer is letter C. The client scheduled for open cholecystectomy who smokes 2 packs of cigarettes per day, because the location of the incision of this cholecystectomy is actually closer to the lungs, and the patient here might actually need to have a general anesthesia. And then if there is a history of heavy smoking, this will make the client high risk for pulmonary complications. So the answer for number 5, C. 6. The nurse is performing an ostomy care for a client who has an abdominal peritoneal resection with a permanent sigmoid colostomy. Rank the following interventions in order of priority. So we're actually ranking the interventions when we are going to be caring for an ostomy. 1, cleanse the stoma site with mild soap and water. 2, let's assess the stoma for a pink, moist appearance. 3, monitor the drainage in the ostomy drainage bag. 4, apply stoma adhesive paste to the skin around the stoma. 5, attach the stoma drainage bag to the abdomen. Of course, we know that the last thing that we need to do is number 5, attach the ostomy band, drainage bag to the abdomen. So when we prioritize things here, we need to check. Of course, we need to uh, have an assessment first. No, so when we do assess, the first thing that we need to do is to look at the ostomy drainage bag. What's the color of it? So that's part of assessment. After that, after checking the drainage bag, we're gonna be looking into the stoma itself if it actually appears pink and there is moist appearance. So therefore, it's 3-2. The next is you have to cleanse the stoma site. Then after cleansing, we need to apply stoma adhesive paste. And then last is the attach the stoma drainage bag to the abdomen. So the best answer here is 3, 2, 1, 4, 5. That's 3, 2, 1, 4, 5. 3, 2, 1, 4, 5 is choice letter C. That's choice letter C. Number 6 is letter C. 7. The nurse is transcribing the healthcare provider's orders for a client who is scheduled for an emergency appendectomy and is being transferred from the emergency department to the surgical unit. Which order should the nurse implement first? We need to implement first. A. Obtain the client's informed consent. B. Administer 2 milligram of IV morphine every 4 hours PRN. C. Shave the lower leg right abdominal quadrant. Already administer the on-call intravenous piggyback antibiotic. Of course, in this case, our priority is not about medication. Remember, when we are answering an option, it has to be important for us to focus on independent nursing interventions. But I think these are requiring doctor's order, but of course, we focus not on medications, but rather on something that is uh, probably significant for the procedure. Remember, all of these are actually implemented to the patient because there's a need for us to have pre-medications, but that's not priority. So the first thing that we need to do is to make sure that there is an informed consent that is basically signed. So of course, the one who secured that one is basically the physician, but we have to serve as a witness. Of course, it's very important for us to verify from the doctor if the patient's consent has been already signed. So therefore, the best answer is letter A. The second thing that you need to do is basically on administering the pre-op medications. Shaving the lower right abdominal quadrant is basically done inside the operating room already. So the best answer here is letter A. 8. The client 1 day post-operative abdominal surgery has an evisceration of the wound. Which intervention should the nurse implement first? Of course, we know that evisceration is basically the protrusion of internal organs. When I say dehiscence, that's basically popping out of the suture. So what will you do? A place sterile normal saline gauze on the eviscerated area. Letter B, reinforce the abdominal dressing with an abdominal pad. Letter C, assess the client's abdominal bowel sounds. Letter D, place the client in left lateral position. The position here is, we don't know yet the position of the patient. So here, if there is actually evisceration, uh, you should not provide much pressure to the abdomen. That's why the most significant common sense will tell us that if there's going to be something that is protruding, therefore we should not provide much of the pressure to that area. That is why it's very important for us to position the patient in a supine position. Sorry. Sorry. The nurse assess the bowel sounds, but that's not a priority over applying a sterile gauze. So the best answer here is letter A. And of course, the nurse can also place an abdominal pad, but our priority that we need to do is placing a normal saline on the eviscerated area. So number 8 is letter A. 9. The medical surgical nurse has received the EM shift report. Which are the following, or which client should the nurse assess first? Again, assessed first. A. The client who has a paralytic ileus and has absent bowel sounds. Letter B. The client who is 2 days post-op abdominal surgery and has a soft, tender abdomen. Letter C. The client who is 6 hours post-operative and has an abdominal wound dehiscence. Letter D. The client who has a liver transplant that is being transferred to the rehabilitation unit. Of course, you need to prioritize uh, something that is going to have a problem then or possible complication. We'll eliminate uh, letter B because here the client is 2 days post-operative already and the abdomen is actually not rigid. So here the patient is uh, probably prioritize, or the patient here is going to be placed as your last to be assessed. And then letter D is also eliminated because the patient here is already for rehabilitation, so that could be placed last. And then since there's the letter A has a paralytic ileus, it's expected that there will be no bowel sounds because from the word itself, paralytic ileus, there will be no peristaltic movement. Therefore, it is expected that the patient here has no bowel sounds. Best answer, letter C, the client who is 6 hours post-operative and has an abdominal wound dehiscence because there is wound dehiscence is actually premature bursting or opening of the wound along the surgical suture, and it's considered to be a medical emergency that requires further assessment for the nurse to do because you're actually preventing the occurrence of evisceration. So number 9 is letter C. 10. Number 10 is the client is being prepared for a colonoscopy in the day surgery center. The charge nurse observes the primary nurse instructing the nursing attendant to assist the client to the bathroom. Which action should the charge nurse implement? A. Take no action because this is appropriate delegation. Letter B. Tell the nursing attendant to obtain a bedside commode for the client. Letter C. Discuss the inappropriate delegation of the nursing task. Letter D. Document the situation in an adverse occurrence report. Of course, here, if the charge nurse is if the primary nurse is instructing the nursing attendant to assist the patient to the bathroom, there's nothing wrong with it. It's because there is there that's actually part of their routine activity. So there's no need for you to obtain a bedside commode because there was no order of bed rest with no toilet privileges. And of course, as what I mentioned, letter if there will be opposing options, one of which is actually correct. A and C are actually opposing. Take no action, and letter D discuss the inappropriate delegation. It means there's something wrong. And letter D document the situation in an adverse occurrence report. As what I mentioned, C and D has the same meaning. So the best answer is letter A. So it's basically significant for the nursing attendant to assist the client to the bathroom because that's part of his daily routine, and it requires no action by the church nurse. Answer for number 10, letter A. 11. The nurse is caring for a client on a surgical unit. Which line should the nurse assess first? Assess first. A. The client has been vomiting for 2 days and has an IBG of 7.47. That's actually alkalotic in nature. Then PaO2 95, that's normal. PaCO2 44, that's normal. HCO3, that's highly elevated because the patient here has uh, elevated pH. Letter B, the client is 8 hours post-operative for splenectomy and who is complaining of abdominal pain. Rating is 9 on Spain scale of 1 to 10. Letter C, the client is 12 hours post-operative abdominal surgery and has dark green bile draining in the nasogastric tube. Letter D, the client is 2 days post-operative for hiatal hernia repair and is complaining of feeling constipated. Of course, we know that if the patient is 2 days post-operative and uh, complaining of constipation since there is hiatal hernia repair, that's not a priority because our priority here is to check if the patient is having untoward uh, incident or situation that might actually going to hinder the operation. And then of course letter C is eliminated also because we know that it's considered to be normal to have draining in the nasogastric tube that has solution of dark green bile. That's normal because there is an abdominal surgery. So the best answer for number 11 is letter B because pain is considered to be part of the vital signs, and the nurse must determine if this expected postoperative pain or is considered to be a complication of surgery, and the client should actually be assessed first. And letter A is eliminated also because that is metabolic alkalosis that is not related to RASPI function. 11, the best answer is Bravo. 12. The client is admitted to the critical care unit after a motor vehicle accident. The client asks the nurse, do you know if the person in the car is all right? The nurse knows the person died, which statement supports the ethical principle of veracity. A, I'm not sure how the other person is doing. Letter B, I will try to find out the other person is doing. Letter C, you should rest now and try not to worry about it. Or letter D, I am sorry to have to tell you, but the person died. Of course, we talk about veracity. You have to be truthful. So as what I mentioned before, if there will be, this is talking about therapeutic communication. If there's the word worry there, then that's immediately wrong. So letter C is wrong because try not to worry. That's false reassurance. And then of course, as what I mentioned also before, that if there are options that has of the same words that is being used, that is eliminated. A and B use the word person is doing, or other person is doing, then that should be eliminated because there's no such thing as two answers in a given question. Answer for number 4, letter D. I'm sorry to have to tell you, but the person died because that is basically your duty to tell the truth. And this statement is probably going to cause an upset of the client, but it will actually going to uh, be focusing on the reality. 12, the best answer is D. Number 13. This question is basically on genitourinary alterations already. So number 13, the nurse is caring for following clients on medical unit. Which client should the nurse assess first? A, the client with acute glomerulonephritis who has a oliguria and periorbital edema. Letter B, the client with benign prostatic hypertrophy who has blood oozing from the intravenous site. Letter C, the client with renal calculi who is complaining of flank pain rated as a 5 on a pain scale of 1 to 10. Letter D, the client with nephrotic syndrome who has proteinuria and hypoalbuminemia. Of course, we'll eliminate letter D immediately because the nurse would actually expect the client with nephrotic syndrome to have proteinuria or presence of protein in the urine, and at the same time hypoalbuminuria, which is basically presence of decreased protein in the blood. So this nephrotic syndrome is basically a non-specific disorder of the kidney in which the kidneys are being damaged, causing them to leak large amount of protein into the urine. And then we also have to eliminate letter C, which is pain scale of 5 of 10 because that's already moderate. So it's expected that the client here will have pain, and of course, having level 5 pain indicates that the pain is actually under control. Therefore, the client does not need to be immediately assessed. What is our answer? The answer is letter B, because of blood oozing from the intravenous site. So in that case, we need to take into consideration that it might be that the patient is experiencing DIC or your disseminated intravascular coagulation, which is basically a potentially life-threatening complication, and that is requiring an immediate intervention by the healthcare team. And of course, letter A, that is glomerulonephritis, and then the patient here is expected to have uh, this periorbital edema and at the same time oliguria. And because this condition is actually damaging the glomerulus, and also which is going to have problems also of the small blood vessels in the kidneys. 13, the best answer is letter B. 14. The nurse is inserting an indwelling catheter into a male elderly client. Which intervention should the nurse implement first? Implement first. A. Ask the nurse or ask the client if he has any prostate problem. Letter B. Determine if the client has any betadine allergies. Letter C. Lubricate the end of the indwelling catheter. Letter D. Ensure urine is obtained in the indwelling catheter. Of course, first. So it means this thing is expected to be done by the patient, or it expected to be performed with the patient. We'll have to eliminate letter D because that's not priority. Ensure urine is obtained in the indwelling catheter. That should be done last. Okay, obtain urine should be obtained in the catheter, and but it's considered to be uh, the last thing that we need to do. Then of course you will do lubricating of the indwelling catheter prior to insertion. So remember first, you are going to talk about assessment. Letter A and B are part of assessment. And then ang letter A, that's actually considered to be appropriate. But of course, even a client with prostate problems can still be inserted with indwelling catheter, but have to do it carefully. Answer here is letter B. Determine the client has any betadine allergies because the catheter or the kit itself includes betadine. So it might be that there's a need for you to have another cleaning form or another cleaning agent that will be used before you insert the catheter because, of course, that could cause possible allergic reactions to the patient. 14 is B. 15. The nurse is preparing to administer intravenous narcotic medication to the client who has renal calculi and is complaining of pain rated as 8 on a 1 to 10 pain scale. The client's vital signs are stable. Which intervention should the nurse implement first? Implement first, that's another priority. A. Clamp the IV tubing proximal to the port of the medication administration. B. Administer the narcotic medication slowly over 2 minutes. Letter C. Check the medication administration record against the hospital identification band. Letter D. Determine if the client's intravenous site is patent. Take note first, therefore, we're looking into an assessment. So A and B, eliminate. Administer, that's already an intervention. Letter A, that's already an intervention. Therefore, it's between C and D, which is ensuring check the medication administration record against hospital identification ban, or determine if the client's intravenous site is patent. Of course, here you should do checking the patency of the site first before ensuring that uh, or checking the medication administration record. So what will you do here is letter D. That is actually ensuring that the administration site is actually patent as to prevent the occurrence of your IV or the medication to have infiltration. Then letter D eliminate also because that's going to be done after doing letter D. 15, answer D. 16. The nurse is administering medications to clients on a surgical unit. Which medication should a nurse administer first? First, A. The narcotic analgesic, morphine. IV infusion to a patient who is 8 hours post-operative and is complaining of pain. Rating is at 7 in a 1 to 10 pain scale. Letter B. An aminoglycoside antibiotic, vancomycin intravenous piggyback to a client with an infected abdominal wound. Letter C. A proton pump inhibitor, pantoprazole or Protonex IV intravenous piggyback to the client who is at risk for developing stress ulcer. Letter D, the loop diuretic first intravenous push to a client who has undergone surgical debridement of the lower limb. Of course, here we talk about priority. We know that pain is fifth vital sign. Therefore, that's a priority. Answer here is letter A. Because we know that the client who's actually in pain is considered to be priority. And this might be that uh, the client here has a possible life-threatening condition. Therefore, we have to focus on that. And then antibiotics can actually be given the last. We can give a proton pump inhibitor the second. Third is your furosemide, and then fourth is your aminoglycoside, which is your vancomycin. 16, the best answer is A. 17. The nurse and the nursing attendant are caring for four clients on a surgical unit. Which action by the nursing attendant warrants immediate intervention? A. The nursing attendant empties the indwelling catheter bag for the client with transurethral resection of the prostate. Letter B, the nursing attendant assists the client who received an IV narcotic, analgesic 30 minutes ago to ambulate in the hall. Letter C, the nursing attendant provides apple juice to the client with nephrectomy who has just been advanced to a clear liquid diet. Or letter D, the nursing attendant applies moisture barrier cream to the elderly client with urinary incontinence who has an excoriated perianal area. So applying letter D is eliminated immediately. That's not a priority. That does not need immediate intervention. Then moisture barrier is considered to be not a medication. So therefore, the attendant here can actually apply that. And then letter C is also not a problem because juice is considered to be uh, a clear liquid diet. And then the best answer here is letter B. The nursing attendant assists a client who is receiving an IV narcotic analgesic 30 minutes ago to ambulate in the hall because there's a risk for possible fall since a medication can cause dizziness. So the client here should not be allowed to ambulate. And then letter A is that's not a priority because emptying a catheter or indwelling catheter is a routine activity of the nursing attendant. 17, B. 18. The church nurse is making shift reports or shift assignments to the surgical staff, which consists of two nurses, two licensed practical nurses, and two nursing attendants. Which assignment would be most appropriate for the church nurse to make? A. Instruct the nurse to administer all PRN medication. Letter B. Instruct the nursing attendant to clean the recently vacated room. Letter C. Assign the LPN to change the client's uh, ileal conduit bag. Or letter D. The nurse request the LPN to complete the admission for our new client. The question here is most appropriate for the church nurse to make. So, sorry. Letter A, instruct the nurse to administer all PRN medication. So in that case, there is a need for us to wait for the need for the administration. And then letter B, instruct the nursing attendant to clean the recently vacated room. Uh, it's actually going to be not the responsibility of the nursing attendant only. So letter D, request the LPN to complete the admission for a new client. Admission is basically the responsibility of the nurse, but not delegated to the LPN. But of course, LPN can perform procedures which is part of their scope. And sometimes included with that is the change of an ileal conduit bag. Number 18, best answer is C. That's letter C. Sorry, it should be letter C. That's not letter D. That's typo error. 19. The church nurse is making assignments in a day surgery center. Which client should be assigned to the most experienced nurse? A. 24-year-old who had a circumcision and is being prepared for discharge. Letter B. The client who's scheduled for a cystectomy, who is crying and upset about the surgery. Letter B. The client diagnosed with kidney cancer is receiving 2 units of blood. Letter D, the client who has end-stage renal disease and had an arteriovenous fistula. Of course, eliminate natin diretso yung letter B. Why? Because that is actually psychosocial but not physiological. So there's need for us to uh, focus on the physiological aspect. Then, of course, creation of your AV fistula is considered to be requiring further assessment. And of course, the client is not being discharged home at this time. So there's no need for further discussions. So the best answer for number 19 is letter A, because here there's a need for us to have a thorough teaching prior to discharging the patient. So because there might be instances that there is an occurrence of your post-operative complications, so the client must have to be very much knowledgeable of when to call and follow up for have the follow up or call the healthcare provider if there is going to be any time for the patient to note some possible complications, especially on the surgical side. So 19 is A. That's their A. 20. The nurse is completing an admission assessment and a client scheduled for cystectomy with creation of an ileal conduit. The client tells the nurse, I am taking Sopalmeta for my enlarged prostate. Which intervention should the nurse implement first? A. Notify the healthcare provider to write an order for the herbal supplement. Letter B. The nurse ask the client why he is taking an herb for his enlarged prostate. Letter C. Consult with pharmacist to determine any potential drug interaction. Or letter D. Look up Sopalmeta in the physician's desk reference. So in this case, when you talk about physician's desk reference, this is basically a tool or a book that is basically available to research medications but actually not focus on herbal medications. Letter D eliminate. And then we'll also have to eliminate letter B because asking why is considered to be not therapeutic. And asking for clarification to the client is actually not the first intervention. But of course, many clients usually use herbal medications that is basically on based on some of the variety of healthcare needs. And then notifying the healthcare provider uh, to write an order for the herbal supplement basically can actually cause the client to continue to take the herbal medication. Then, however, it's not actually our first priority. Our priority here is to check if the supplemento will have a drug interactions to the medication that has been given to a patient who is about to have cystectomy. So number 20, the best answer is letter C. 21. The client scheduled for dilatation curettage is upset because the healthcare provider told her she had syphilis. The client asked the nurse, this is so embarrassing. Do you have to tell anyone about this? Which statement is the nurse's best response? A. This must be reported to the Public Health Department and your sexual partner. Letter B. According to the Health Insurance Portability and Accountability Act, I cannot report this to anyone without your permission. Letter C. You really should tell your sexual partner so they can be treated for syphilis. Or letter D. I realize you're embarrassed. Would you like to talk about the situation? So in this case, you need to be factual because this is actually going to be talking about communicable disease. No, so that needs to be reported. So uh, letter C is not our priority, and also letter D, because our priority this time is to report the case because there has to be contact tracing. So the best answer is letter A, and of course, the Department of Health will attempt to notify any sexual partners of the client and has to be reported for possible screening and at the same time treatment. And of course, HIPAA is it's not going to be applied in this situation because the nurse must be knowledgeable about HIPAA guidelines already. And then the client should notify her sexual partner. However, in response to asking the client, does anyone have to know? The nurse's best response is to provide facts. So number 21 is letter A. 22. The nurse is caring for clients in the renal unit. Which task is most appropriate for the nurse to delegate to the nursing assistant? Instruct the client nursing assistant to calculate the client's urinary intake and output. Request the nursing assistant to double check unit of blood that is being administered. To the nursing assistant to change the surgical dressing on the client with kidney transplant. Letter D. Ask the nursing assistant to transfer the client from renal unit to the intensive care unit. Eliminate B, C, D, because the answer is letter A. You're just going to calculate it. There's nothing wrong with it. Letter B, that requires an assessment that should not be done. Letter C, uh, that's also requiring an assessment because you're changing the surgical dressing. And also letter D, that requires an assessment because you're transporting a patient to another unit. 22, the answer is A. 23. The nurse is caring for clients on a medical unit and making assignments for the day shift. Which client should the nurse assess first? A, the client diagnosed with interstitial cystitis, who has urinary urgency and pain in the bladder. Letter B, the client with acute post-streptococcal glomerulonephritis, who has hematuria of the smoky appearance. Letter C, the client diagnosed with Goods Pasture syndrome, who has pallor anemia and renal failure. Letter D, the client diagnosed with nephrolititis, who has hematuria and is complaining of pain, rating it 9 in a scale of 1 to 10. Of course, eliminate natin yung letter A because it's considered to be signs and the signs and symptoms are actually expected for this client to have, especially with the presence of your interstitial cystitis. It's actually a chronic and painful inflammatory disease, and it's characterized by the presence of urinary urgency or urinary frequency. Of course, there might be pain in the bladder, and that could possibly extend to the pelvis. But the symptom that is present there is actually considered to be normal. The letter B, or expected, not normal, but expected. And then letter B is also going to be eliminated because this is going to include manifestations of edema. There might be presence also of hypertension or liguria. There will also be hematuria and with a smoky or rosy appearance and proteinuria. So these are also expected. So when you talk about Goodpasture syndrome, it's basically a rare autoimmune disease that is seen primarily in young male smokers, characterized by presence of hematuria. There will be presence of weakness, pallor, and anemia, and of course, it might end up renal failure. This is also going to be an expected assessment. Answer here is letter D. The client with nephrolithiasis who has hematuria and is complaining of pain, rating at 9 on a 1 to 10 pain scale, because the nurse must assess the pain in order to determine whether there is a complication that is happening to the patient. And we know that the pain is actually considered to be our fifth vital sign. Answer for 23, delta. 24. The nursing attendant reports to the nurse. The nursing attendant reports to the nurse the client's urine output has bright red blood. Which intervention should the nurse implement first? A. Instruct the nursing attendant to take a urine specimen to the laboratory. Letter B. Document the findings in the client's record. Letter C. Assess the client's urine specimen and complete the renal assessment. Letter D. Ask the nursing attendant to take the client's vital signs. Of course, we know that if this is the information that is going to be received, there's a need for us to verify things. So we need to verify things before document. Eliminate letter B. And then also, it's not the responsibility. There's no need for us to immediately refer them to the laboratory because there's a need for us to conduct a validation assessment. So the best answer for number 24 is letter C, assess the client's urine specimen and complete a renal assessment. And then vital signs is going to be done, but it is not our first intervention. 24, answer C. Let's now have the last number, 25. The nurse is making a client assignment. Which client should the nurse assign to the graduate nurse who has just finished orientation? A. Client with cystectomy who has a creation of an ileal conduit. B. Client who on continuous hemodialysis who is awaiting on a kidney transplant. Letter C. The client with renal trauma secondary to a motor vehicle accident. Letter D. The client who has an abdominal surgery and whose wound has eviscerated. Of course, eliminate letter D immediately because if there is an evisceration that requires further assessment, this client is considered to be critically ill and should be assigned and should not be assigned to an inexperienced nurse. And then letter C is also eliminated because we know that renal trauma is unpredictable and requires continuous assessment. So a more experienced nurse should be assigned to this client. And then letter B is also eliminated because we know that if the client has continuous hemodialysis, would require a trained nurse in this area of nursing such as a hemodialysis nurse. So the client should be assigned to a more experienced nurse. The best answer for number 25 is letter A. So we know that his cystectomy is a major surgical procedure. It's considered to be predictable, and there will be no complication. There were no complications identified. So after the bladder has been removed, the client must have an annealer conduit, and it's considered to be expected with this type of surgery. And the new nurse could be assigned to this client. So answer for number 25 is letter A. So that's it. Thank you so much for your time, everybody. Congratulations to those who made it on top. So that is it. Thank you.